Hi, everybody, and welcome to the EMS Today Show. I'm AJ Heitman, the editor emeritus. I'm pleased to be your host, and with me today is Dr. Randy Katz, and I'll tell you a little bit about Randy in a minute. But we're going to be talking about skilled nursing facilities, and actually today they're really surfacing as hotspots in the clusters of COVID-19 outbreaks. So I asked Randy to come on because Dr. Pepe, in his Metropolitan Medical Director's briefing, was praising the work that Randy's been doing with skilled nursing facilities, and I thought he'd have a very interesting perspective. Randy's the Medical Director, Emergency Medical Services for Memorial Regional Hospital in Hollywood, Florida, which is going to be the new host for the Eagles once we get the pandemic all behind us. And he's a board-certified emergency medicine physician who earned his medical degree from Nova Southeastern University College of Osteopathic Medicine in 1999 and completed his internship at Maimonides Medical Center in 2000. He completed his emergency and internal medicine residency at St. Barnabas Hospital, a very busy hospital, in 2014. He served as chairman of the emergency medicine at Memorial Regional Hospital since 2008. And he's also the medical director for the City of Hollywood Fire Rescue and the medical director for Medics Ambulance Service. We've talked on flying. I guess I pretty much understand. Very unique to Florida is the fact that they operate 8 units at peak times and out of 10 stations, and they serve a population of 250,000. But those medic units, they are staffed by a crew of 3. Much like Miami does, and I'm a fan of that. If your municipality will fund that, that's 3 people on a truck is certainly a luxury that most people in the country don't have. And they're an all ALS system. So, Randy, welcome, and you're a new member of the Metropolitan Medical Directors, and we're glad to have you on board.
Thanks, AJ. I appreciate it.
So, skilled nursing facilities. We've talked offline a little bit about the horror and just the way that the nursing home in New Jersey got overrun with just patients dying on them left and right. And suddenly somebody tips off the police. They go in and find 13 bodies in a room designed to hold 4 as a temporary morgue. And it's an awful story. And it's very interesting that in your system, tell our listeners how many nursing facilities you have.
Yeah, so we're a fairly decent-sized city, but not a large city like New York or Chicago. I would consider us a medium, moderate-sized city. And within our city boundaries, we have 56 ALFs, SNFs, and rehab centers.
That's a lot. That's a lot of patients. And if we can, I think, what we really have to talk about for the providers here is the fact that, and everybody knows this, when you're in a SNF, you've got some comorbidity factors, and right now maybe you want to address the patients that you're seeing that are coming in with COVID-19. If they've got comorbidity factors, they can be in trouble.
Yeah, I mean, if you look at least the volume of patients we've seen over the past 3 or 4 weeks, the ones that we've had to admit to the hospital, and the overwhelming majority of mortalities we have been in the over 65 population and patients that have comorbidities like diabetes, hypertension, and cardiovascular disease.
And the reason that we're doing this show today is really to focus on the SNFs, to talk about the fact that this issue is not going to go away. First of all, the virus isn't going to go away for a while, and we're going to have reoccurring incidents and hotspots in nursing facilities unless they start to develop maybe a different attitude. And you can relay the first incident that you had from a nursing facility and how that was handled, because I think that's what Paul was really calling out.
Yeah, so back in 2017, most of you remember Hurricane Irma, direct hit for the most part to South Florida. And if most of you remember, which you probably do, there was a nursing home which happened to be adjacent to my hospital that I practice out of. And that nursing home was the site of 13 unfortunate nursing home patients who died, basically because of lack of electricity and lack of attention to the problem. And I remember the day like it was yesterday. It was very early in the morning. I got a call. We had run our fire rescue agency that I'm the medical director for, ran 3 calls between 2 in the morning and 5 in the morning, back to back, cardiac arrest calls. And our crew actually brought the information to our emergency department at 5 o'clock in the morning to tell us, listen, there's a nursing home here. We've gone 3 times already. It's over 90 degrees in there. There's no electricity. We're afraid there's something really bad going on there. We've had to transport 3 cardiac arrest patients in the past 3 hours. And we took it upon ourselves as a healthcare system to literally walk across the street into this nursing home and assess the situation. And, the story unfolds from there. And from there, 13, people died and perished, and, the families that suffered. And, that experience really never left me. And, as we move into this COVID crisis with the density of nursing homes, all I can think about whenever we transport a patient to the emergency department with this virus is, the same thing can happen. It doesn't have to be heat exhaustion. It can be a virus infecting people. It can be neglect. But, unfortunately, these are patients, as you mentioned, have, multiple comorbidities. Many of them have dementia. These are helpless people. Right now, they're not allowing visitors, so the families don't even know how their family members are doing. And some of these attentive families are very good about going to visit their family members on a daily basis and really, making sure they're getting the care that they need. But when they can't get into the nursing home, it's really left to the staff to, sort of handle things and hope that they make the right decisions. And like this case that you mentioned in New Jersey, 17 people are dead there. And the staff that's supposed to work there essentially deserted the patients. So, we rely on the people working there, take care of these people. And sometimes those people are overwhelmed and scared. And when there's nobody there to take care of these people, things like this happen. So, my goal from day one, when this started, and the first nursing home patient I saw get transported to our emergency department, was to just prevent that from happening again. The same thing I saw in 2017.
So when that first patient came to you, what actions did you take?
So about 3 weeks ago, South Florida, everybody's on different timelines, but about three and a half weeks ago, we saw our first few cases. And one of the first EMS transports we saw was an elderly patient who came in pretty sick. And I get a report essentially every day. We've had the luxury in our institution of having molecular testing, PCR testing available from the day this started. And those tests we've had available, within 24 hours, we get results. So that transport came in from a nursing home. The next day I got the results. And that same day that I got the results on that patient, we got another transport from the same nursing home with a fever and bilateral pneumonia. So the first thing we did is essentially assemble the team on the hospital side, our CNO and a number of people on our leadership team who reached out to the nursing home administration to let them know that they had a couple patients that tested positive. They were very willing to have us come over there and help them assess the situation and really, try and help them prevent further spread in their institution. And this is a very large healthcare provider in our community. They have over 200 rehab, SNF, and ALF patients in this facility. And it's very close to the hospital. So we assembled the team. It was a Friday morning. We went out there. We brought our Tyvek suits and our N95 masks and our goggles. And we essentially did our own epidemiology. We found out, what unit was this patient, housed when they were there, who was in contact with them, did they have a roommate? And we kind of did our own investigation. And what we found was that the second patient that came in was the roommate of the first patient. The healthcare providers that were in contact with that little area involved about 25 healthcare providers. And it was really one wing of the institution. We brought our facilities people with us as well to look at the ventilation and really assess sort of the facility side of things to help them understand, how this can spread in their institution. And at the same time, we contacted the Department of Health and ACA, which is our accrediting institution for hospitals and ALFs in the state. So while we were there, they actually showed up with a team of nurses. And so we worked together. The administration of the nursing home was very welcoming to us. They wanted us to help them. They understand the gravity of the problem. we assembled a team and we offered our services, and the state showed up with 4 nurses, and basically between the DOH, the Department of Health, and their nursing staff, we went in and assessed every patient in the nursing home and took vital signs. And our epidemiology, sort of investigation and looking at how do we incorporate some testing to do some screening on some of these people that were potentially exposed. We offered that to their employees and to other patients in their institution. And what we found was that there were a handful of asymptomatic providers in that institution that tested positive in that 24-hour period when we tested them.
Wow.
And we were able to essentially identify who these people were, avoid them from having any further contact from anybody in the institution, and they were able to quarantine a lot of the patients that were in the same rooms or nearby. And I have not seen another case, and that was 3.5 weeks ago. I have not seen another COVID-19 case from that institution, which makes me feel like our job was worthwhile.
Now, were any of those asymptomatic staff members that had cared for those 2 positive patients?
Sure. One was a nurse and the other one was a physician who was rounding in these nursing homes.
And did they have full protective equipment, or did you find that they needed some?
So they did have some masks, some surgical masks, but they did not have a lot of the equipment they needed, like gowns and N95 masks. So part of what we did in the county, and maybe another piece of this, is that our EMS agencies down here work really well together through previous experiences with the incident in 2017 and the density of nursing homes in all the cities in South Florida. We realized that this is a very vulnerable population, and so we immediately, the state recognizes that, our governor recognized it from the very beginning, and our EMS providers did. And so we actually have a sort of a SWAT team that goes out and does regular rounds on these ALFs and nursing homes, and we've been doing that from the very beginning. And what we do is we identify places that either have lapses in protocol, where maybe they're not doing the things that they need to do, and we help educate them. And we also deliver PPE. So one of the things we did for that nursing home is one of our ex-EMS chiefs, who now works for the state, came in his pickup truck with a bunch of PPE and basically furnished that to those providers there. And we've been doing that to every nursing home around the county individually, almost on a weekly basis since then.
Now, where do you think we're going to end up with testing? Because in your case, you made the offer. They took you up on the offer, and you might have saved a few lives with that. But are we going to be able to sustain this? You think the federal government's going to give us enough funds and test kits to help with this?
Well, I think right now, at least state by state, there's different resources available. In the state of Florida, testing, although it's been fairly prevalent across the state, compared to many other states, it's still nowhere near where it needs to be with respect to screening, and surveillance. We're testing symptomatic people, and for a long time, we really only use CDC criteria to test people. At my institution, we've been very fortunate to have testing available, and as of this week, we're testing every single admission to the hospital. But I could tell you, not many hospitals have that capability, and the federal government and the state government clearly has nowhere near the testing capacity they need to appropriately screen these places. What we've been talking about recently, and part of what's happened over the past 3 weeks since that incident, is that I now have 9 nursing homes in my city that EMS has transported a patient who's tested positive. And as we started getting to the 3rd institution and 4th institution, we realized we just don't have the ability to screen all of their employees and do mass testing for all of these institutions. So I've been very vocal with our state leaders to express to them the importance of getting this resource out to these places. There's some reports of the National Guard coming this week. I haven't seen them yet in our city, but there are some plans to bring in the National Guard to provide some of that testing, provided by federal money, and the state's planning on doing that. And I think really, to me, testing is a very key piece to controlling spread and quarantining people, and without knowing who has what, and understanding that we do have asymptomatic carriers of this disease, whatever that percent is, we don't really know. Without the testing capability, it makes it extremely difficult to do anything.
Yeah, I think we talked offline. My dad was in a skilled nursing facility right up until his death, and when he was in a assisted living, he was happy as a clam because he had his own little room. And when he was in the skilled nursing facility, it was a challenge for them. There were so many patients, and I'd call and ask to speak to him, and I couldn't even get a phone to his bedside. And, I felt pretty helpless. And I thought the other day when we were chatting that if he was still in that nursing facility, I'm not sure what I would do. Go and try and get him out and put him back at home where he could have a visiting nurse come and take care of him. I really don't know, but it's hard for them to take care with the staffing shortages, et cetera. And everybody in there has got a problem.
Yeah, let me share a quick story with you. The other day I got a call from, well, we received a new patient from a new nursing home, and it was an ALF actually. Not a big ALF, fairly small one with 24 patients. And we tested the patient. The patient's test was positive the following day. So I called up the nursing administrator there, and she happens to be the owner, and she's a nurse. And what she told me was that all of the staff deserted her and her husband. And it was a small ALF, but her and her husband were essentially taking care of 24 patients. And there's no way that two people can effectively manage 24 people in an ALF. And, once they knew somebody was positive, essentially all of the staff deserted her and her husband. And so we brought her and her husband in and tested them to make sure that they didn't have COVID-19, and they didn't. But we reached out to the state, and we provided a bunch of resources for them to, at least get some nurses and some people in there to help them out. But, this is what goes on. I could tell you that during Hurricane Irma, when some of these places had no power for 6 or 7 days, people just stopped coming into work. But the patients are there, and they're not going anywhere. And unfortunately, these staff members that, techs and, nurses' aides, they don't make a lot of money. With this virus, in these facilities, they don't have proper PPE. And it's really hard to blame them for not wanting to go into work in that environment. It's a tough situation. And it's really something the federal government, the state governments, and the local governments really, really need to pay attention to. These are people that essentially have nobody looking out for them. Family members can't visit these people. If they have dementia or they can't pick up the phone, they can't talk to their family members. We have, if you have a family member right now in an ALF, you have no idea how they're doing. And, it's unfortunate, but that's the situation we're in.
And you as a medical director, you had good cooperation with that large facility, but suppose they just kind of slammed the phone on you or said, no, we're not going to allow you to come in here. You just have to turn them over to the Department of Health and hope something happens, right?
Yeah, that's, we typically, whenever we find a case now, we identify a positive case from a new facility or a facility where maybe we saw one and now we're seeing 2 or 3. We always contact the Department of Health first. We get them involved. I contact our sort of hit team with EMS so that they get out there, and then we go out ourselves or we contact them ourselves. So I find that hitting things from different sides, getting EMS involved and knowing that somebody from EMS is going to get out there and assess the facility and see what needs they have. The Department of Health, is always notified, so they're always getting their regulatory team out there to visit. The governor, in the state of Florida has been very proactive with the ALFs, but there is a limited number of resources, and testing is just one of them, but people's another. And when you have this many nursing homes in a state and this many ALFs, it's very difficult without those resources there.
Yeah, I think you heard that in New York, even off of the Navy ship, they got a squad or 2 of medically trained of the Navy medics and sent them out in the community to places that were hot spots. And I think that's what we're going to have to do. We're going to have to be a little bit more creative and innovative. So for people that are listening that have nursing facilities, what would your recommendations be for them? Contact them?
Well, yeah, I think just being on a lot of the Eagles calls the past few weeks and listening to what's going on in a lot of cities around the country. There are cities like New York that EMS is just absolutely overwhelmed, and it's hard for EMS to do anything more than their job. But in other cities, EMS volume's down 20-30%, and we have guys idle, in fire stations, and EMS stations, sitting idle and not running as many calls. And I think in those cities, if you do have ALFs and nursing homes, we should be using that time and that resource to get out there and try and provide, whether it's PPE, donating PPE to them and helping them with some of that resource, going out there and visiting them and looking at their policies and making sure they have the appropriate policies in place and make sure they're following state guidelines. And if they're not, report them, to the appropriate agencies. I think, we do have some excess capacity right now. And I think that is an area of focus. I could tell you that as the 3 weeks have gone by, although we stopped an outbreak in one facility, we now have 9 facilities, and I still see patients trickling in from facilities that we've identified. And I don't, as an institution and as an EMS agency, I don't have the resources to get out to all 9 of these every day and test everybody, or every week. We do what we can, but I think if every agency around the country kind of, looked at that from a responsibility standpoint, said, part of my responsibility as an EMS provider, and it's going to become their problem at some point anyway. These are where the EMS calls are coming from. Skilled nursing facilities, the elderly population who can't get themselves to the hospital. They're going to become your patients. So it behooves you to be proactive, get out there, visit these nursing homes, see what their needs are, and try and help them any way we can as EMS agencies.
Now, legally, they don't have to show me their policies, though, do they?
I don't think so. I mean, I don't think there's any, depending on, I guess, which state you're in. In the state of Florida, an EMS agency can't just show up and mandate that they, come into the nursing home. The state regulatory bodies can, but as local EMS agencies, we don't have that ability to do that.
Well, one of the things I talked to somebody, I used to be an operations director, and they were talking about, well, what would you be doing? Because we were talking about some of the Eagles things. And I said that it really is, when you listen to the Eagles and you listen to 50 people on that call and you hear skilled nursing facility in Seattle and New Jersey problems, et cetera, then all of a sudden you begin to realize, wow, that's really where you got to focus on something. And I said that, I would perhaps have somebody stop by, a supervisor or whatever, saying that, we're reviewing our mass casualty plans. We consider this in the pandemic to be an MCI. We want to make sure our plans coordinate with yours. Do you have proper electricity? Do you have any needs that we can help you with? Just to kind of get the feel if something's wrong. You'll know when you walk down the halls if you got something going wrong, if you see no nursing staff available.
And looking at each of these cases, I could tell you the first nursing home that I was discussing earlier that we went to, it turned out that the first patient that we identified, when we went back to trace where that patient came from, the patient was just discharged from a local hospital. And it was a hospital that doesn't really have testing capacity. They were still sending out their specimens to the Department of Health. And it was taking them a week, 7, 8 days to get results back. And so unfortunately, a lot of the hospitals were discharging patients into ALFs a couple of weeks ago without doing testing, without screening, which we're so concerned about the employees and the people bringing the infection in through the front door. Yet it's the back door many times where some of these patients are bringing infection in. So, again, testing is just super important, with these places. And I think screening, developing some policies with your local hospitals where if any patient, we went out and called every one of our nursing homes in our city and we said, if any hospital is discharging a patient to your facility, make sure that they're screened and tested before you receive that patient. Otherwise, you're opening a door. And what we know is that these patients, when they get this infection, they don't do well. Their mortality rates are extremely high. And if you let this go for a week, without identifying it in one of these institutions, you can have 15, 20, 30 mortalities on your hand that are preventable. And, we've seen it in Seattle, the nursing home in Seattle, where I think there were 17, 18 deaths. The one in New Jersey that was just reported in the New York Times where 17 bodies were found in the back. I've seen it here in my own community, with Hurricane Irma. It can happen anywhere. And I think we all need to be, aware of that in our communities and do what we can to prevent it.
Well, I like a couple of action items. I like the idea of stopping by the facility, letting them know that we care, trying to make sure that we can make arrangements for their staff to be tested. That would show the staff that we care. And I think they'd be a little more conducive to us coming in if we come in and offer to test them and then ask if they have any patients of concern while we're there. And the issue is, who's testing in your community? Just your hospital, or do you have community centers or clinics that are doing some civilian testing?
Yeah, they set up a couple civilian testing centers in the community. Early on, they had some issues with, swab availability, so they had to shut it down for a few days. They ran out of swabs. Some of the labs were taking 7, 8 days to get results back to the patient. So, the turnaround times on the labs were difficult. But things have gotten better. We now have, I think, 3 community testing centers. Some of them are pretty large, do a fair amount of volume. I haven't heard of any running out of any, swabs or things like that lately. So we do have a fair amount of testing capacity. The problem we've had is that we're able to screen the employees. We can have them walk over to our hospital, and we have a tent outside, and we do, testing there. The problem is, the patients, if you've got 200 patients in one of these nursing homes, I can't go out there and test 200 patients. I can't run them through our lab without registering them as a patient. And so that part gets a little difficult. But the staff we can screen, and if you do both the staff and the patients, I think you hit a home run. You can really, prevent disasters from happening in these places. And we don't have any way to do that at this point. So it is an opportunity, I think, that we're missing. And, the National Guard is coming in, and maybe the National Guard, would provide that service and test all patients. If you have a place that has a cluster of patients, to be able to test all of the patients at once and all of the staff members in one day and collect all those swabs, and within a few days get those results back, you can really do a lot of things with segregation and quarantining, and really prevent spread of virus in these facilities. But again, it's a resource issue right now, and until we get there as a country, I just don't see that happening anytime soon. But there's things we can do, and again, all the things that I mentioned are things we've done, and we've been able to control the number of patients coming from these facilities. The problem is that the number of facilities continue to multiply. And, there's one or two here and one or two there. And we're able to get out there and inform them quickly, and then they can isolate, the patients that were in contact and the staff members, and send staff in, get them tested. But unfortunately, it's kind of a slow trickle right now. And we're getting ahead of it, but it's kind of, like a bucket with different holes in it. You put your finger in one hole and it keeps leaking out of another hole. So, we're making a little bit of progress, and, I think things would be much worse if we weren't doing what we're doing. And there's that risk of having a disaster at any point.
I'm going to be talking to Jeff Clausen, and we're going to be talking about Protocol 36 of the Emergency Medical Dispatch, and that will be very interesting. And one of the things that we were talking in advance of the show is that there's a lot of people at home, and it comes up on the CAD that there's an invalid at that home. And it's not a bad idea right now to have your comm center tell you where those invalids are and go around and make sure that they're being taken care of, because they could be very sick, and getting the rest of the kids and family that are taking care of them the same way. So
yeah, absolutely.
I guess our job is to try and prevent a lot of hotbeds from starting to and you also mentioned that statewide, you think that there's a pretty good attitude from your state leaders about the SNFs and the ALS.
Yeah, there was a lot of talk early on, a month ago, about the ALFs and SNFs and how important it will be to pay attention to these places, when all of this started. So, we did put together our own, little task force with EMS to make sure we get out there and assess. And I could tell you that we have not had one nursing home tell us, get lost, stay out of our nursing home. It depends on how you approach it, but I could tell you they're very welcoming when you approach it from, hey, we want to help you prevent problems. We're here to help you. And if you offer things like testing and PPE, I mean, I could tell you that I have a number of the nursing administrators on my cell phone now. And as soon as they send a patient in, they're like, hey, tell me what the results are. Can you tell me if this patient was positive? They want to know, and they want that help. And I now, provide that service to them, personally. I had a patient today came in, and the first thing I got was a text from the nursing home administrator. Hey, can you let me know when the results come back on this patient? And then, if it's positive, they can do something about it. So, a lot of information, sharing, resource sharing. I mean, if you do that stuff with them, they're not going to tell you no, that you're not welcome there. They're going to ask for help.
But again, you're lucky with your facility, because you're saying every discharged patient is being tested, right?
Correct. Yeah, we have a strict policy. We test them 24 hours apart before we send them to any ALF or SNF.
All right, so that's another to-do item. If you're an ALS administrator, you should have your medical director or somebody check with them to make sure that your hospitals are doing that before they send somebody back, because they could be sending the problem right back. If they're not doing testing, that person could be asymptomatic and respond right back to the nursing facility.
Absolutely.
Great. Well, Randy Katz, thank you very much. My hat's off to you. 2 thumbs up for the work that you're doing there.
Thanks, Adrian.
Stay safe, and see you on the next Eagles call.
Yeah, pleasure talking to you. Thanks a lot.
Thank you, sir.